Good evening and welcome to Vax Facts and FAQs. Vax Facts and FAQs is a virtual discussion on how to stay healthy and get up-to-date information on the flu and COVID-19. This month, we will be discussing pandemic updates, the triple Demmick, COVID-19 mortality, and of course, our frequently asked questions. Oops. All right, like we said, we'll start with our COVID-19 updates. So at this time, a small percentage of the U.S. has been classified with high COVID-19 community levels. And that is indicated on the left in the orange. And so as you can see, there's not that many counties relative to the entire United States that have that classification. There's a lot of green, a little bit less yellow, which is the medium classification. And that trend of very little high and medium classification continues in Michigan here on the right. So in Wayne County and a lot of the nearby counties, such as Washtenaw and Oakland County, have low community levels for COVID-19. And monitoring the community levels is a great tool to gauge what protections you need to practice to minimize the risk of exposure to COVID-19. And so for this classification, the low community level classification, it is recommended that we stay up to date with our COVID-19 vaccine, wear a mask if we have symptoms, or if you have a positive test, or if you have been exposed to someone with COVID-19. You should also wear a mask on public transportation, like if you take the metro to and from work, maybe even in your Uber and things like that. And you may choose to wear a mask at any time as an additional precaution to protect yourself. So if, for example, you notice or you know for a fact that you're going to be in a very crowded room and you're unsure of the ventilation, you may still choose to wear a mask. And having this option to incorporate that additional protection is especially important for those that are high risk for severe illness. So you may, if you are high risk, you may consider wearing a mask indoors and in public and taking additional precautions. Next, we're going to talk about the triple Demmick, which is COVID, flu, and RSV. The cold and flu season has been off to an early start. There is a concern for a triple Demmick due to flu, COVID-19, and RSV circulating simultaneously before peak season. There is a potential that these three diseases circulating at the same time, along with the common cold, can overwhelm our health systems. And unfortunately, many people may get sick, and especially children are, especially susceptible to RSV and are at risk for severe complications from the flu as well. So the term triple Demmick has been coined just for that awareness and concern that we're feeling as these viruses are circulating. Like I said, these cases are especially increasing across the country for flu, which can be especially dangerous for older adults, the immunocompromised, pregnant women, and children. So it's important that we continue to urge our coworkers and our friends and our loved ones to get vaccinated against influenza and against COVID, especially as we get ready to gather more often with the holiday season among us. So while there's no vaccine at the moment for RSV, protecting ourselves with additional precautions that we know that are effective against preventing the spread of disease, such as hand washing and other personal hygienes, avoiding touching our eyes, nose, and our mouth, and monitoring our symptoms and making that choice of, should I be around family at this time, or should I just stay home and rest and not spread it to my loved ones? So next, we're going to talk about COVID-19 symptoms. So at the start of the pandemic, we noticed kind of a variety of symptoms. There were some symptoms that were closely aligned to the common cold or the flu, symptoms of respiratory viruses that we are used to, headache, runny nose, sore throat, sneezing. But then there are also those very COVID-specific symptoms, like losing your smell and taste. Those are very specific to COVID, and upon onset of those symptoms, you kind of knew that you had COVID, or you had an inkling that you might, and you're like, I'm going to go get tested, right? But according to a recent study that was completed, the COVID-19 symptoms and how they're presenting are changing a little bit. So they are varying slightly based on your vaccination status, which is what we have broken out for you here on the slide. So among the three categories of, your vaccination status, so unvaccinated, partially vaccinated, and fully vaccinated, there are some shared symptoms among those three categories. So that includes the headache, the runny nose, sore throat, and persistent cough. So those four are kind of the same, and they range true for all three of those vaccination status categories. However, the fifth symptom of this top five is the one that has varied based on your vaccination status. So that one symptom for those who are unvaccinated is a fever. This fifth symptom is prominent for those that are unvaccinated. For those that are partially vaccinated, the symptom was sneezing. And then for those who are fully vaccinated, it was a blocked nose that was that varying symptom that was unique to that vaccination status. And what's important to know is that this is not the end-all, be-all. You may have any combination of these symptoms, and it's still important to get tested, especially with how closely aligned these symptoms are to the other respiratory viruses that are circulating at this time. And so if you are experiencing these symptoms, it is important that you do get tested for COVID-19. This is a risk that is still existing, and it's unfortunate, but what is most important is that you know how COVID is currently presenting, and so that you can monitor yourself and your loved ones, especially kids, and take the proper action, such as getting tested. And the earlier you test, the better your chances on getting treatment, your treatment options in order, especially if you are high risk. So it is important to know how COVID-19 is presenting itself. So next we're going to talk about COVID-19 mortality outcomes. So there has been a significant decline of the COVID-19 deaths in the US, which is great. And there are a few contributing factors to that decline, including high levels of population immunity, whether that be from vaccination or from previous infection. Another contributing factor is the improvement of early treatment, especially for those that are at risk for severe disease. That has tremendously improved our COVID-19 health outcomes. And the best protection for preventing severe COVID-19 complications and outcomes is to be up to date on your vaccines and to be utilizing the treatment options that are available. And the treatment options, the antivirals that are available, and it's important that you test early so that you can get those treatment options as soon as possible. So it's vaccination, testing, and treatment. Those three are a power trio that can help improve, our national COVID-19 outcomes, but also our individual COVID-19 outcomes. But along with, that power trio of vaccination, testing, and treatment, you can also protect yourself, and you should also protect yourself by wearing a mask, where needed, as we talked about. You can kind of amp up the masking, if you are at risk, or if you just feel more comfortable that way, depending on which crowd you're in, or making sure you're wearing a mask, at least on public transportation, and things of that nature. And also, we can improve our COVID-19 outcomes by improving ventilation in certain spaces, and like we said earlier, with preventing flu and RSV and COVID-19. Hand washing. It is so important. It's a great public health accomplishment that we have been able to push something so simple as hand washing, but it is effective at preventing the spread of viruses like COVID-19. And again, avoiding touching your eyes, your nose, and your mouth. It's very important, especially for kids, that we take all these measures and utilize them to the best of our ability to prevent negative COVID-19 outcomes. So next, we're going to talk about our frequently asked questions. So the first question is, should I visit loved ones this holiday season? It is understandable that people are nervous about travel and being in touch in person with our loved ones this holiday season. And it's exhausting for everyone to have to be concerned with this dilemma, the scenario year after year during cold and flu season, but also while we're grappling with COVID, flu, RSV. And so I kind of have 6 tips for us so that we can feel secure in our decision on whether we travel or not, because ultimately it is an individual decision, and it's an individual decision that you can make with some guidance from VFF and the CDC and the Kidney Foundation. So my first tip is, of course, stay up to date with your vaccines. It's still the best way to prevent the spread of COVID-19 and flu and other viral diseases. And if you're going to take a trip out of the country, you should really look at the travel requirements for that country and what the recommendations are as well. And the second tip is to be cautious leading up to a trip. I've had coworkers that decide to work from home that week that they're going to go home and visit, or making sure they're masking, making sure they're doing their personal hygiene, like hand washing, to make sure that they're lowering their chances of getting sick before travel. Another tip is to mask while traveling, especially on public transportation. It's important that you have that extra protective measure. And it's also important to know that, sometimes ventilation is an issue. crowds are an issue. So utilizing your mask as a tool while traveling is really important. Of course, wash your hands. That's my next tip. It is so important to wash your hands. And if you aren't able to, wash your hands with soap and water, hand sanitizer is a great alternative, and you can do it on the fly. So utilizing hand washing and hand sanitizer is really important for while you're traveling and getting prepared to travel. My next tip is to test more than once before gathering, if possible. Testing is important to, because you could be asymptomatic. You could, just have a little sniffle and just want to make sure. But testing beforehand, it's one less thing you have to worry about while you're traveling. Like, okay, great, I tested negative before my trip, and I can just have that weight lifted off of me while I'm spending time with my family. You can also recommend that friends and family test before gathering, not just an individual testing for yourself. So especially if you're hanging around older family members, the extremely young family members, it's really important that, you have that bubble around them so that they are safe as well. And 6, this is probably the most important tip, is knowing when you have to sit one out. It's hard, especially because this is the time of the year where you see loved ones that you haven't seen in a while, maybe all year or, a couple of years. I know it's hard, but it's important to know when you have to sit it out. So if you're sick and you're sick, you're running all these symptoms, it's important to protect yourself and protect your family. One, because you need rest to properly heal. And it's hard to rest while traveling, and it's hard to take care of yourself while traveling, but also you don't want to spread something like COVID or flu or RSV to your loved ones. So you kind of have to make that sacrifice to keep other people safe. So this can be done with testing, monitoring your symptoms, and then making that decision for yourself. Like I said, it's an individual decision, but there's some guidance that I can provide you to help you make the most educated decision that you can, so that everyone can have a great holiday without any illness at all, hopefully. Okay, the next question. Do I have to quarantine if I test positive for COVID-19? So this is really important, especially as we're traveling and we're on the go. And if you're test positive, it's hard to know what the recommendations are. And also because there have been some changes, so I think it's important that we take a look at the quarantine recommendations, the isolation recommendations, because it could be really important. So regardless of your vaccination status, you should isolate from others when you have COVID-19. It doesn't matter if you've been recently vaccinated or boosted or anything like that. If you test positive, you should isolate from others. And if you have multiple people in your home, you should try to isolate within your home if possible. You should also isolate if you're sick and you suspect you have COVID-19, but do not have your test results yet. So again, that is really important before travel, during travel. If you start to feel something, maybe just try to get a test as soon as possible. But until then, it's recommended that you isolate if you suspect that you have COVID. And if you test positive, again, stay at home for at least 5 days and isolate from others in your home. During this 5 days, you're at your most infectious point. That's the best way I can say it. So that 5 days is really essential in preventing the spread of COVID-19. So if you do test positive, you should isolate, stay home, quarantine, however you want to put it, for those first 5 days. So I tested positive, or I've been confirmed with the flu. What are my next steps? So let's start with COVID, because we kind of just touched on it a little bit. So like we just mentioned, it's important to isolate and follow those isolation recommendations. However, I think it's important to add that if you are at high risk for severe illness, you should test and treat it early on. That is what is, like we said, that's that triple threat in preventing the spread of COVID-19 and preventing unfavorable health outcomes because of COVID-19. So let's say you test positive. If you are high risk, you should try to get in touch with your healthcare provider so that you can get access to treatment if they feel that that is necessary for you. And the recommendation is similar for the flu. So usually with the flu, you can get by with rest and plenty of fluids. You're gonna feel really sick and it's not gonna be fun, but you stay home, you rest, you relax as much as possible, and you kind of treat your symptoms. But if you have a severe infection or you're at higher risk for complications, so the elderly, the immunocompromised, pregnant women, and children, your healthcare provider again might prescribe a treatment option such as an antiviral to help treat the flu. So that is the recommendations for if you do test positive for COVID or the flu. And that can be important, again, while we're traveling, to know your risk level, to know, to monitor your symptoms so that if you do start to feel unwell, that you can take the right precautions and get yourself feeling better as soon as possible. So thank you for joining us on this presentation of Vax Facts and FAQs. And if you have any questions or feedback that you can provide to us, we'd greatly appreciate it. You can reach out via email at reach@nkfm.org, or you can visit www.nkfm.org and provide feedback there. So thank you again and have a great night.